Hello, everyone, and welcome to today's episode of Let's Talk About Health. I am your host, Madeline Mant, and today we are joined by Corinne Marceau, who is here today to tell us all about her career as a senior donation consultant. So, welcome to the show, Corinne.
Hey, thanks so much for having me.
So, I need to ask you immediately, what is a senior donation consultant? What are people donating? And how did you find yourself in this fascinating career?
Yeah, so a senior donation consultant is just a title we made up. And it essentially is meant to describe a position in the administration of organ and tissue donation. And the purpose of that basically is to do staff education, quality improvement program projects, and hospital development to try and optimize organ and tissue donation rates throughout the province and expand the availability of tissue and organ donation throughout the province. That's kind of the short version that I have been giving to people, but it does involve a lot of different aspects. So we're coordinating and supporting the work of donation organizations in managing the organ and tissue donation system in Alberta.
Mhm.
And part of that is trying to build a strong culture of donation by increasing awareness around what organ and tissue donation are. A lot of people are very familiar with organ donation. Less people are familiar with tissue donation. So um, in my experience here in Alberta, tissue donation means the following tissues can be recovered from a deceased donor for transplantation. So that includes the eyes for things like cornea transplants, and the sclera can also be used. Skin for skin grafts to help severe burn victims. It includes bone and tendon for things like joint reconstruction, tumor reconstruction, and spinal fusion surgeries. And also heart valves for heart valve replacement surgeries in pediatric patients. So basically, those are the tissues that I'm referring to. We also do a couple of living donor programs here in Alberta. We have a surgical bone program where we ask people who are going for hip surgery if we can have the femoral head, and that can be sent out for use in other surgeries. And essentially, it's used as a packing material during surgeries that are using instrumentation or things like spinal fusion. And we also have an amniotic membrane program where we can contact mothers who are going for a planned cesarean section to see if we can collect the placenta and basically process the amniotic membrane into kind of a living bandage that's most often used after eye surgery or for sensitive areas, burns to sensitive areas like the hands and face. Or things like wound closure in serious cases where there are complications. So that's tissue donation in a nutshell. Some organizations do additional tissues, and some tissue banks are more focused as a skin bank or an eye bank. So what else can I say about tissue donation? Basically, this is how I started in this position. Is I worked in tissue donation for 14 years as essentially a tissue donor coordinator and recovery technician. So I did everything from screening potential donors, speaking to families after their loved one had died to offer them the option of donation and go through an informed consent and a medical and social history questionnaire that screens a lot of different criteria to see if the patient would be eligible for tissue donation or if there's something that might defer them as a donor, very similar to the one that they do for blood donation. I would do medical record review and chart review. We would actually do the surgical recovery of the tissues. We would also do processing of some of the tissues and some of the tissues like heart valves required special training. Some of the tissues like corneas, we would all do the processing of corneas, but then some specialized training is required to do different types of grafts from those. We would also I had the opportunity to see kind of the results of tissue donation. So we would distribute the tissues to surgeons for transplant. And sometimes we would hear back from the recipients, writing to their donor families to thank them for the donation. Or sometimes we would hear from tissue donor families who wanted to write to the recipients of their loved one's tissues just to tell them a bit about their loved one and their gifts of donation. I did do some kind of in-servicing to do staff education on hospital units and hospices to inform them about referring to the organization for tissue donation. And now that's a big part of my job, is educating staff to try and increase tissue donation referrals. So yeah, that's the long-winded answer, I guess.
No, that's so detailed. That's so exciting. And my goodness, it really, I was going to say, what's the day to day in this? But it sounds like it has been incredibly varied over the course of your career so far.
Yes, so I started recently and it has been incredibly varied. So I have developed skills in organ donation medical record review that I didn't previously have. So we actually do review deaths in all of the major hospitals throughout Alberta to see if there are missed opportunities for organ donation. Families that were not approached where the patient may have been eligible for organ donation. And so, yeah, we're doing those medical record reviews day to day, which is super interesting, kind of like being a medical detective, following the clues to see if various deferral criteria might be present and whether the person was actually considered for donation after neurological criteria or donation after cardiocirculatory death, DNC and DCD. I've been doing some hospital development. So we've developed, we've reached out to leadership and developed these teams where we can kind of explore the donation workflow, try to identify and act upon potential barriers to donor identification, referral, and documentation that the person was considered for donation. And this is all part of like quality improvement, which I had no prior experience in. So that's been a good learning curve. And yeah, we just basically try to, hospital development is anything that we can do to support organ and tissue donation at our sites. And so we're just trying to provide that support for quality improvement, system performance development, change management, and also to celebrate successes. So to thank them every time we do get an organ or a tissue donor, and it can make a difference in the lives of all of these recipients.
Mm-hmm. Now, I'm really interested because we talk in these interviews about words around health and illness and disease and sickness. And so there are a variety of places in which I feel like that could resonate in your work, both with donors and with recipients. How do those words make sense within your area of expertise?
Yeah, so with transplants, we're obviously just treating the symptom of disease. With organ transplants, especially, there are a lot of spiritual and social aspects of illness that are impacted by receiving a transplant. And the organ transplant program in particular, I think does a really good job of, and is increasingly expanding, taking care of those spiritual and social aspects of the patient that is receiving a transplant. Unfortunately, the aspect of donation that I've worked in is more about dealing with families who are dealing with grief, who have lost a loved one. So where I see myself working in that spectrum is in offering what some would consider as a spiritual and social aspect of death in terms of leaving a legacy and being able to help others through the gift of organ and tissue donation. So that role that we play as donor coordinators is more in terms of family support. And although in some cultures, the mortuary practices surrounding the body are what's most important. In other cultures, that legacy is prioritized over the body itself. And so not every person is going to want to donate organs and tissues as part of the dying process. And I've even spoken to palliative patients who really appreciate being offered the option to make the decision themselves, to do that informed consent before they pass away. When they know that death is imminent, they can participate in the whole process themselves. And then they know that they're leaving that legacy when they pass away. So it is about spiritual comfort in those cases. So although it's not for everyone, I do think that in the interest of like equitable treatment, respect for people's autonomy within, a Western biomedical system that can be very harsh for someone experiencing a loved one dying. I think it's important to offer every one of those grieving family members the same option of, would they like to proceed with organ or tissue donation? Is that something they would have considered? Are they aware of their loved one's wishes? What do they think about passing on that legacy if that was something that the patient would have wanted?
Hmm. Well, it's so interesting to hear about how much of this job is about speaking with the living and talking
Yes,
with families and thinking about one person and maybe their organs, but then the patients they could go to. It feels like there's a lot of ripples that would sort of move from the center of this.
absolutely. It's also a patient safety issue. If we look at the recipients who are in dire need of an organ transplant, who may be dying on the waiting list, it does impact their health if we can offer the option of organ and tissue donation to everybody who wants it. If we can expand that culture of donation and just raise awareness about donation so that everybody expects to be offered this option, then we can hopefully provide more life-saving and life-enhancing organs and tissues to the recipients who are waiting for them.
Well, this is so important. It's obviously so important. As I'm listening, I'm going, yes, absolutely. And I imagine there's somebody else out there watching this that's going, yes, this is really inspirational. So, how would somebody that was interested in following in your footsteps pursue a career like this?
Yeah, so great question. I'm from Alberta. We have a very small tissue bank, I would say, small but mighty. We have a small team, but we're actually one of the only comprehensive tissue centers in Canada where we actually do the recovery, the processing, and the distribution of all types of tissues. So in other provinces, it may be different. You may be looking for a career at an eye bank specifically, or potentially just at a skin bank, or potentially in an organ donation program, or in a living donor program. So I would say that most of the opportunities for donor coordinator, for example, where you would be speaking with the families, doing the medical screening and that kind of thing, would require a nursing degree. So that's one great way to get into the field of donation and transplant. For myself, it was a little bit of a different journey. So I know one of your previous guests said, as advice to anyone who wants to get into an interesting field, be open to opportunities and network. The way that I found out about the tissue center here is I was taking an anatomy class after my graduate degree. I was taking a graduate level anatomy course in dissection, and I had just finished my graduate degree in forensic anthropology, and I met someone who worked at the tissue center, and I thought, how odd. We're taking this anatomy class together, and yet you are essentially doing surgery to recover tissues for transplantation.
Mm.
Thought it was fascinating. So when I finished my degree and my after degree work, I took a casual position at the tissue center, and I worked doing tissue recoveries on call as a casual staff member while I was actually teaching anthropology and anatomy at Portage College. So I was cobbling together part-time jobs and contract work and trying to I didn't have like a full-time job, so I was kind of trying to cobble something together towards a career. And yeah, eventually that led me to a permanent position at the tissue center. And yeah, that's basically how I got into it. So not everyone can take the path that I took. A background in anatomy was extremely helpful. The background in human osteology obviously applies to the bones and the joints and the tendons, not so much to recovering a heart. So everything that I did in my graduate career was very valuable, but probably the most valuable thing was just being open to talking to people, meeting people, exchanging ideas, and being curious about what other people do. I would say that there are many different opportunities within organ and tissue donation in Canada. Um, uh, Canadian Blood Services, for example, has a whole division of organ and tissue donation in terms of promoting awareness and public education. But my advice would be to kind of look into what your province has, or the province where you want to work eventually,
Mhm.
in terms of their tissue donation system, or their organ donation system. And so some of these jobs are hospital related, but some of them are located in an eye bank, a regional recovery center, or a tissue bank. So yeah, ask questions, find out more about the type of organization that exists where you live.
Well, I love that advice, that being open to opportunities, networking, but also just staying open and curious as to what other people are doing, which is exactly why I do this series. I'm super curious about other people's work. So I want to say thank you so much for joining us today, for sharing your time and your expertise about this fascinating career. And thank you always to our audience for joining us today. And we will see you next time on Let's Talk About Health.